Hello people, in this video we want to learn what pulsus paradoxus is. See, normal pulse if you just represent like this, so we'll just remove that dichotic notch, but if we just see it without the dichotic notch, it will look like this. And pulsus paradoxus will be something like this, where during the inspiration the volume is reduced. Okay, so this is, see, normal has become like this. This is pulsus paradoxus. There's an exaggerated reduction in the strength of the arterial pulse during normal inspiration, or an exaggerated inspiratory fall in the systolic pressure of more than 10 mm mercury during quiet breathing. So there's a fall in systolic pressure in inspiration, during inspiration. So when do you see this? Cardiac tamponade. So around the heart there is restriction, right? Tamponade. What is tamponade? There is pressure on the heart. When will it occur? During inspiration. You're breathing in, right? That time there is more pressure on the heart. Then constrictive pericarditis. So there is something which is constricting the heart. Constrictive pericarditis. Airway obstruction due to asthma. So if there is severe, acute severe asthma, airway obstruction is there. So what happens in asthma? The air actually cannot exit, right? It enters but it cannot leave. That is what is asthma, right? So that is why there is more pressure on the heart. So it cannot give you the volume that you require, right? Then what else? SVC obstruction. If there is superior vena cava obstruction, so the superior vena cava is obstructed. So what will happen? Blood won't even go to the heart. So the heart's output, the pulse will be reduced during inspiration. Okay. So this is pulsus paradoxus. Hope you understood. So what is pulsus paradoxus? It is the decreased pulse volume during inspiration. It happens because of what and all did you see? Cardiac tamponade, right? That is pressure on the heart, constrictive pericarditis, asthma, severe acute asthma, SVC obstruction, that is superior vena cava obstruction. Okay. So during inspiration there is more pressure. So the heart is not able to pump. That's all. Pulsus paradoxus. Now, there is one more terminology, guys, that is reverse pulsus paradoxus. What do you mean by reverse pulsus paradoxus? Where during inspiration there is a rise, okay, inspiratory rise in arterial pressure. So that will be something like this: normal, normal, and more during inspiration. So this is a reverse pulsus paradoxus. Okay, when will you see this? Hypertrophic obstructive cardiomyopathy. Okay, huge heart there, hypertrophic heart. Then intermittent positive pressure ventilation, that is you are giving some positive pressure ventilation. Atrioventricular dissociation. Okay, so that is reverse pulsus paradoxus. So when the person is inspiring, there will be a rise in the pulse volume, that is reverse pulsus paradoxus. So in this video you have understood pulsus paradoxus and reverse pulsus paradoxus.